There's no dramatic downfall or movie-worthy clutching of the chest. Instead, it might start with minor jaw pain, dismissed as dental issues. You may feel some unusual tiredness, chalking it up to a poor night's sleep. Perhaps a fleeting pressure in the chest that fades so quickly it's forgotten by lunchtime. The Cleveland Clinic reports that silent heart attacks occur in 1 out of 5 to 2 out of 5 cases. This means the person experiencing one might feel nothing at all or misinterpret the warning signs as something trivial. Seniors, women, and individuals with diabetes are most likely to overlook these signs. In this video, we will explore the 8 warning signs indicating an impending silent heart attack. These indicators are drawn from the American Heart Association, Mayo Clinic, and Cleveland Clinic. Your body may be desperately trying to alert you to danger, yet these signs can be easily dismissed if you're unaware. We'll review all 8 signs and provide guidance on what steps to take if any resonate with you. The last indicator is particularly surprising, as few connect it to heart issues, yet it could be the most vital. Let's begin with the sign that often leads people to seek the wrong help. When seniors feel an unexplained dull ache in the jaw, neck, or upper back, they generally consult their dentist first. This response is understandable because these sensations feel nothing like typical heart problems. It's not sharp or dramatic but presents as a mild soreness, heaviness, or stiffness in the upper back and shoulders without a clear cause. However, the American Heart Association classifies pain or discomfort spreading to the jaw, neck, back, or arms as potential heart attack warnings. This phenomenon is referred pain. When the heart lacks sufficient blood flow, it sends distress signals through adjacent nerve pathways, leading to discomfort in unrelated areas. If you've experienced unexplained jaw or neck pain recently, especially alongside any other signs listed here, don't prioritize a dental appointment. Consult your doctor about your heart. Next is a sign that's easily overlooked, as many associate it with aging. Unusual fatigue persisting for several days. Not the tiredness from a long day or post-sleep grogginess, but an overwhelming exhaustion that lingers, making daily tasks like walking to the kitchen or getting dressed feel monumental. Since this fatigue develops gradually, most attribute it to old age and dismiss it. The American Heart Association identifies prolonged unusual fatigue as one of the most frequently reported early heart attack indicators, particularly in women, sometimes occurring days or even weeks before the event itself. The reason is simple. When the heart struggles to pump enough blood, your muscles and organs receive reduced oxygen, leading to persistent exhaustion. If you or someone you know feels deeply tired without obvious reasons for several days, don't chalk it up to aging. Report it to a doctor and mention your heart. Keep in mind that fatigue is only part of the story. Stopping there means missing something vital. Seniors suffering a silent heart attack often mistake it for indigestion or heartburn. This confusion is hazardous because the symptoms can be nearly indistinguishable. A burning sensation can move from the stomach to the chest, accompanied by fullness or discomfort in the upper abdomen. The instinct is to grab an antacid and wait it out. According to cardiologist Dr. Michael Hogan from Franciscan Health, the main difference is, heartburn from food typically responds well to antacids and improves after eating. However, heartburn stemming from heart issues often arises with physical exertion, doesn't improve with antacids, and is typically paired with shortness of breath. If your indigestion feels different, appears at strange times, or doesn't respond to typical remedies, don't self-treat. Seek a medical evaluation and specifically request a heart assessment. Speaking of shortness of breath, let's delve into that one further. If you feel noticeably winded during activities that previously posed no issues, like walking across a room, ascending a short staircase, or moving around your home, that isn't just aging. The Mayo Clinic highlights shortness of breath as a primary heart attack warning sign, and here's why it's easy to overlook. It can occur without any chest pain at all. Therefore, it emerges independently and feels vaguely like being out of shape, leading people to postpone action. According to the Cleveland Clinic, when a heart attack occurs, the heart's reduced ability to pump effectively causes fluid to pool in the lungs, making breathing difficult even with minimal movement. If you've noticed recent changes in your breathlessness, consult your doctor and specifically state, "I want my heart checked." Don't allow it to be generalized. That covers 4 signs, and we've reached the midpoint. The next one, however, might surprise you, so stay with me. People generally recognize chest pain as a heart attack warning. However, they often expect a sudden, intense pain, akin to dramatic portrayals in films. A silent heart attack typically presents more subtly, with mild pressure, dull squeezing, or a fleeting feeling of fullness that comes and goes. Because these sensations disappear, individuals may dismiss them as unimportant. Dr. Jacqueline Tammies Holland from Cleveland Clinic warns about this pattern: symptoms that appear and fade, lasting 5 or 10 minutes, only to disappear. This pattern is perilous, as people often wait too long to seek assistance. If you feel any unexplained pressure, squeezing, or dull discomfort in your chest, even if temporary and passing, take it seriously if it happens more than once. This pattern is not a reason to feel reassured but a signal to act promptly. Now we delve into signs that may seem unrelated but are critical. A sudden, cold, clammy sweat without a cause. An unexpected wave of nausea. A sudden dizziness that urges you to grab onto something. Individually, each symptom may resemble a stomach issue, overheating, or merely a dizzy spell. However, in combination with any signs from this list, they indicate something serious. The American Heart Association acknowledges all 3, cold sweats, nausea, and sudden dizziness, as heart attack warning signs, particularly prevalent among older adults and women who might not display classic chest pain symptoms. This is dangerous because they mimic flu or stomach virus symptoms, prompting individuals to lie down and wait. If these symptoms strike suddenly and unexpectedly, especially with other signs, do not hesitate, call emergency services. The next sign involves heart rhythm changes that many notice yet do not act upon. A sudden awareness of your heartbeat, whether racing, fluttering, pounding, or irregular, rarely occurs without justification. The American Heart Association categorizes rapid or irregular heartbeats as warning signs of a heart attack. When blood flow to heart muscle is diminished or obstructed, the heart's electrical system can be disrupted, causing irregular rhythms. While occasional awareness of your heartbeat is typically harmless, a sudden, unexplained change, especially alongside other symptoms like fatigue, breathlessness, or chest discomfort, demands immediate medical attention, not a wait-and-see approach. Now, let's discuss the 8th sign, the one many neglect, though it might be the most significant. Numerous heart attack survivors describe experiencing a profound sense of dread prior to their event. This isn't anxiety over a specific issue, but rather a deep fear that something is amiss, something they can't quite place. The American Heart Association officially recognizes this feeling of impending doom as a legitimate symptom of a heart attack, more commonly reported by women and older adults. Your body possesses an incredible ability to signal distress before your conscious mind can articulate it. If you sense that something is profoundly wrong, trust that instinct. Communicate it and seek help. Such instincts exist for a reason. Let's wrap up this discussion, focusing on what genuinely matters. If you are experiencing any combination of these signs at this moment, stop watching and call emergency services immediately. Don't drive yourself to the hospital. Don't wait to see if it passes. Don't dismiss it as likely being nothing. Penn State Health emphasizes that every minute without intervention intensifies heart muscle damage, and the time frame for effective treatment is measured in minutes, not hours. If you're not in immediate distress, here's what cardiologists advise for all seniors watching. First, schedule a heart health assessment with your doctor this week, requesting specific tests for blood pressure, cholesterol, and blood sugar. Second, be aware of your health numbers, as high blood pressure and cholesterol are leading contributors to silent heart attacks in seniors and often show no symptoms until significant damage has occurred. Finally, share this video with a loved one. A silent heart attack survivor once told a Cleveland Clinic cardiologist that knowing these warning signs was the sole reason they sought timely intervention. If you found this video helpful today, please consider leaving a comment below, just to inform us which sign surprised you the most. It genuinely assists in disseminating this information to those who need it. If you'd like to continue learning about heart and health safety after 60, subscribe to Golden Health Guide and hit the bell icon so you never miss a new video. Our channel publishes clear, reliable health information every week for adults aged 50 and older, with many more heart health and senior wellness videos available for you to explore. A silent heart attack doesn't have to result in tragedy, provided you know what signs to watch for and take your body's signals seriously. Please share this video with someone important to you. The 8 warning signs discussed today could indeed save a life. This video serves educational and informational purposes only, and it does not substitute for professional medical advice, diagnosis, or treatment. If you believe you might be experiencing a heart attack or other medical emergency, call emergency services immediately. Do not delay seeking urgent help based on anything you've seen in this video.